ACL surgery can be scary for anyone. We know you have some questions about recovery, and we're going to answer some of those right here.
Before we begin, it's important to remember that any information found here is not a substitute for the recommendations of your doctor or surgeon. Now, let's get to our first question that a lot of people ask us. When can I drive again? We know how important driving is to most people's lives, so lots of research has gone into how quickly patients should get back behind the wheel after surgery on their leg. First off, you should never drive while under the influence of pain medication. It may seem obvious, and you might even feel totally normal, but it's not safe to drive if you're regularly taking medicine that can sedate you. Second, it's important to consider which leg is affected. Unless you drive a manual transmission, surgery on your right leg will mean a longer time off than if it's your left. The key factor in the timing is your ability to react to potential dangers on the road. Surgery takes your knee out of its normal state and slows down your braking time, which is how long it takes you to hit the brakes in an emergency. In fact, studies have shown that it can take up to 6 weeks to get back to normal speed, so until you gain the appropriate strength and coordination, it may be best to have someone else drive you. While 6 weeks may seem like an eternity, it's important to remember that these are just guidelines. It's up to your doctor and treatment team to give you the green light. On to the next one. What restrictions will I have after surgery? In the early days after ACL surgery, you're not going to feel exactly like yourself, and your leg may feel weaker than normal. Occasionally, your doctors may choose to use nerve blocks that may intentionally leave your leg numb or weak after surgery as part of the plan to control your pain. As a result, your doctor will often limit your weight bearing and recommend crutches or a cane for a period of time after surgery. Bracing may also be recommended, but not in all cases. Click here to learn more. The timing for these restrictions depends on your surgeon's preference, or whether you had any other types of procedures performed at the same time, such as a repair of a torn meniscus, which may require some extra protection. It's also important to have help at home, so your limitations don't put you in any potentially dangerous situations. Let's move on to the next common question. Will there be pain? The fear of pain is something that weighs on every patient's mind who is about to undergo surgery. There are several methods that are used to combat post-surgical pain, and often your doctors will implement a multi-dimensional approach. A combination of treatments can be used, including oral medications, local injections right at the site, nerve blocks to keep your leg numb, or spinal anesthesia to target an even wider area. All of these methods have proven to be effective when used properly, though the specifics may vary from surgeon to surgeon. In any case, despite everyone's best efforts, it's natural to experience at least some pain and discomfort after your surgery. In most cases, this is just a normal part of the process and can be controlled by your prescribed medication, rest, and periodic ice. And while we know you may be tough, it's always important to stay ahead of the pain by not letting it get too severe before you take medication. It's much harder to play catch-up than to keep pain at bay throughout your recovery. Remember that pain control, like every part of your recovery, is a team effort. So for best results, discuss a plan with your doctor and anesthesiologist, and stick to it. Let's hear from our own Stu Holdens about his experience after ACL surgery.
I felt great the day of surgery because I later came to find out they put some pain-numbing medicine in there, and I thought that I didn't even have surgery at all because it felt so great. It wasn't until the next day where I woke up and the pain hit me a little bit. But that didn't last long, honestly. I mean, everything was just a smooth sailing. It probably took 4 or 5 days before I was up and moving around comfortably doing normal activities again, and 10 days later I was off of crutches.
And now, one last question. When should I call my doctor? There are certain situations after a surgery when it's best for you to speak with or be seen by a medical professional in an urgent manner. While these may be rare, they can be serious, so let's discuss. 1. Severe pain. While some discomfort after surgery is expected, and in many cases is a normal part of the process, if you are having severe pain that isn't helped by your medication, it's a good idea to speak with your doctor or even head to the emergency room. 2. Signs of infection. If you're having any of these symptoms, it may be a sign that you're developing an infection, and it's important to be evaluated in a timely fashion. 3. Excessive swelling, changes in skin color or pulse. Some amount of swelling and bruising can be expected after surgery, and may even be present in locations other than your knee, as gravity will take any extra fluid to different parts of your leg as you keep it elevated. Let's hear from Stu about his experience.
I honestly thought when I took the bandages off of my knee for the first time that I was looking at both of my knees in one. It was like a balloon, and there was so much swelling in there. There was obviously scarring, and there was trauma, and all of which I came to learn was normal. As it progressed and the swelling started to move out, the first thing that I noticed was that the swelling kind of went down my leg, and I started to get a bit of bruising, and that actually really worried me at first, because the bruising was so intense down my calf that I thought maybe I'd had like a clot or something, and with everything I'd read online and was worried about, first thing I did was text a picture to my doctor, Bert Mandelbaum, and his first text back was, "Looks great." So right then I knew that that was normal, and that that was just nature's course essentially, and the swelling was going to come out of my knee, and my body was working in overdrive, and the bruising for me actually was a great sign.
However, if you notice that you're having a feeling of tightness or painful swelling in your leg, changes in your skin to a pale or bluish color, or feelings like you're not getting enough blood flow to your lower leg, it's important to contact your doctor and be evaluated immediately. The bottom line is this: no one knows your body better than you, so if you're experiencing these or any other concerning symptoms, it's best to be safe and get evaluated.
We hope you've discovered some good information. Keep coming back to ReadySetMed for all your medical needs.